friends, today we are going to do L4-L5 endoscopic spine disc surgery. This is a central disc which has more symptoms on the left side. So we give the patient general anesthesia and we position the patient like this for any other endoscopic spine surgery. After positioning the patient, we clean drape the patient and then we give a standard 7 mm skin incision and we insert our endoscope through tubes without cutting any muscle or without cutting any bone, and we create a window for the nerve by selectively removing the soft tissue around the nerve. Here you can see the red thing which is passing by, it is the nerve, and under this red thing is the disc. So by using the hook, we remove this disc fragment from under the nerve that is causing symptoms and giving pain to the patient. This hook is a special instrument, and through that we remove selectively the disc fragment which is pressing the nerve. Here you can see a big white disc fragment coming out. Through the disc we make this fragment free, and without any chances of damage to the nerve, we remove this disc fragment using a special instrument which is sort of a forceps. So we protect the nerve, we remove this disc fragment, and once we remove this disc fragment which is pressing the nerve, patient becomes pain free. So this is the forceps that I am talking about, and using this forceps we remove the disc fragment from under the nerve, and this takes care of the patient's pain. Most of the time it is a big fragment or a single big chunk, but sometimes it can be multiple also. Here you can see that the fragment which is coming out is a big piece. So here you can see it is a big piece. This chunk was placed under the nerve that was causing the pain. So now we have removed this fragment and the patient will become pain free. The entire surgery is done through a 7 mm skin cut, and all the normal tissues are protected. Through the endoscope, we are able to visualize everything in a magnified way, so it makes the surgery very safe. After removing the disc fragment, we normally do not remove additional disc from inside because the disc provides stability to the vertebral column. And after the surgery, we selectively try to close the rent from where the disc fragment came out. So this is also done under endoscopic vision so that everything is safe. Here you can see that we are sealing off the rent from where the disc fragment came out. After the surgery, this is how the nerve looks. This red part, red thing is the nerve, and you can see that it is totally free now, and this is the end of surgery.